Yeah, I mean, David, it seems like common sense. Our partners at the Medicaid Institute found that this legal change actually shifted resources away from low-income children. So it's not only that we're spending more money, but that the money actually flowing to these more vulnerable populations is actually being reduced because we have this expanded higher federal contribution for able-bodied adults. And so that's why we at AFP and the Paragon Institute have been elevating this to Congress to say, hey, this is an idea to save some money this year. You're talking about saving some money. Let's step in and let's just make this equal. We're not even saying get rid of the program or cut the coverage. We're just saying make it equal for all of the populations under the program.
So if our goal is ultimately to cut $2 trillion, that's a pretty unbelievable number, but to cut $2 trillion, how much would these cuts go towards that goal?
Yeah, so these cuts would actually save $529.9 billion over the next 10 years by making this simple change to the program.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential.
Hi, everyone. My name is David Fromm, and I'm the new host of American Potential Podcast. After President Trump's victory in November, he wasted no time in tackling government inefficiency. He announced the creation of the Department of Government Efficiency, better known as DOGE. After taking office, Trump made it official with an executive order not just creating DOGE, but implementing it into every federal agency. So how does this work? Each agency now has a DOGE team that looks at cutting wasteful spending and streamlining operations. So with the creation of DOGE, we are now starting a new series called Big Ideas for Smaller Government. In this series, we will talk about a federal agency or department and share some examples of their wasteful spending, and then what cuts should be made to help save taxpayers money. We'll keep a running total of these cuts because our goal is by the end of this series, we will cut $2 trillion. Today's Big Ideas for a Smaller Government episode is focusing on the Department of Health and Human Services. So, how did the department get its start? Well, under President Eisenhower, the Department of Health, Education, and Welfare was created in 1953. But in 1979, the Education Organization Act was passed, which created the Department of Education and took the Department of Health, Education, and Welfare and renamed it the Department of Health and Human Services, or HHS. So let's jump into this by welcoming today's guest, Jeremiah Mosteller, who is the Policy Director for Americans for Prosperity. Jeremiah, welcome. It's so good to have you on the show again to talk about one of our favorite topics, cutting wasteful government.
I'm so excited, David. Thank you for letting me be here today.
Great. Well, I know that we're going to do a number of episodes together. We've done some in the past, but I know we're going to do a whole bunch of episodes on DOGE and where we feel like we can save taxpayers money. And I know it's a cause near and dear to both of our hearts, so I'm super excited to talk about it.
Yeah, for sure. Very excited.
Well, another goal of this series is to show how large these departments actually are. So, getting into it, just how big is HHS?
Well, David, would you mind? I brought my whiteboard with me. Do you mind if I write some stuff on the board to help listeners and viewers understand a little bit about what we're talking about here?
By all means. I mean,
awesome.
Heck, if you brought it with, we might as well use it.
HHS, like you said, the Health and Human Services Department, it has a budget of $2.86 trillion, which is 25% of the federal budget, which means it is one of the largest in the federal government. It's made of a bunch of different components. You have the Administration for Children and Families. You have the Administration for Community Living. You have the Advanced Research Projects Agency for Health. You have the Administration for Strategic Preparedness and Response. You have the Agency for Toxic Substances and Disease Registry, and the list goes on and on and on to make up this department.
Wow. So my understanding is we're going to be talking about two departments in particular in this massive agency. Which two are those?
Yeah, so we're going to be talking about the National Institute for Health, which is a division within HHS, and then specifically within that, going a level lower, we're going to be talking about the National Institute for Drug Abuse and the National Cancer Institute.
Oh, important stuff.
Yeah.
So, but under the National Institute of Drug Abuse, they did studies on, I believe it's rats and cocaine. So what were these studies and how much did they cost?
Yeah, so NIDA, which is the shorthand for this agency, spent $419,000 to study rats' use of cocaine. And what they were trying to look at was, does a rat who is lonely, bored, or hungry use more cocaine? So what they did was they got a whole group of rats together. They injected them all with cocaine, all of them, and then put them in two separate scenarios. One went into a habitat with a bunch of them together where they had a lot of toys and they had a lot of food. And then the rest they put in individual isolated environments where they had limited food and limited toys. And so interestingly enough, I think what you would expect to be common sense, they found that the rats who were isolated, who didn't have food and who didn't have toys, used a lot more cocaine. And I think the fact that's worth pointing out to listeners is this isn't the only study that NIDA has funded with rats and cocaine. They've actually funded another study that looked at how a bitter taste impacts rats' use of cocaine. So they funded multiple studies on this topic that essentially reach a common sense result.
So they studied the flavor of cocaine? I'm glad we have some empirical data on that one.
Yeah, yes.
Wow. Well, isn't cocaine illegal? An illegal drug? I mean, how do they get their cocaine for these studies?
Yeah, David. So it is a controlled substance under the federal law. There is a whole catalog, though, on the HHS website that any American, any listener you have today, but researchers use it, where they can go in and they can look at all the different types of illegal drugs that they can purchase through this program. And as long as they have approval from a separate agency, the DEA, they can request those drugs and use it within their research. Fun fact, actually, at one point, the only source for marijuana for research was at the University of Mississippi. And they had essentially what was a monopoly on marijuana research and where you could get that marijuana.
That's awesome. It's good to know, I guess. So the National Cancer Institute is in the process of a 5-year study, I believe, on one of the effects of social media. How much did that cost and what are they studying?
Yeah, so this specific study cost $2 million. So what they are essentially trying to determine is, do teens who see junk food ads, do they eat more junk food? So in essence, the National Cancer Institute is spending $2 million to discover marketing at the end of the day. And what they found was exactly what you would expect. Teens who see junk food ads on social media eat more junk food. And so I don't know about you, but that seems pretty common sense. I know I myself, there are some junk foods that really, like if I see an ad, I'm going to crave them for the next week. So for me, that's Oreos. I'm curious if there's something that you have that is like that you crave a lot.
I love Oreos. I don't know if ice cream is considered junk food. I think it's very healthy, actually. It's dairy, good sugars. I think just traditional flavored Doritos are probably my jam. I could eat those every single day. I may or may not put them on my sandwich at times, like a 10-year-old, but yeah.
Yeah. Apologies, I had to sneak an Oreo while you were talking there.
Well, all right. I mean, as long as I get my chance. We got no Doritos here, though, so
I'll hook you up after.
All right. Well, so how does the Institute determine that junk food ads on social media are something that they needed to study? Like, how do they come up with, like, who determines why this is appropriate to spend millions of dollars studying? So
this particular study and the funding for it came through a grant program that the National Cancer Institute set up to determine the causes and how to prevent cancer. And so they have funded over 7,000 pieces of research through that program. And they don't have to justify each individually. These agencies don't have to justify those individual spending lines. They just justify the entire program. But in this instance, the researchers said, hey, poor diet is one of the leading causes or leading factors in getting cancer. And so us studying junk foods and social media in teens will help us determine how we can better ensure that teens have healthy diets. So I think both of us are pretty excited about the work that Doge is going to be doing. And it's starting, I mean, we see that conversation already being really disruptive. I'd say scary to kind of the established bureaucracy. What do we think that they should be focusing on, and like what with regard to HHS, and what should they be cutting from HHS to save Americans money? Yeah, so my team has a lot of ideas, but the big one I want to talk about today is actually another component of HHS, which is the Center for Medicare and Medicaid Services. And so by their name, it's pretty obvious what they do. They run the Medicare and Medicaid programs, which are partnerships with the state. The particular idea we want to talk about today is something that was passed in the Affordable Care Act. So, David, I actually have a question for you. It's going to be multiple choice. Under the Affordable Care Act, who do you think receives the most Medicaid funding? Able-bodied adults, low-income children, the elderly, or the disabled?
unfortunately, the way government runs, I guess I'd say able-bodied adults.
That's right, yes. Under the new rules, able-bodied adults receive a larger percentage of their health care costs covered by the federal government than those other vulnerable populations do.
How is that possible?
Well, they passed a new law and they wanted to give out some higher health care spending. And so the way they set it up was that able-bodied adults get 90% of their coverage covered by the federal government, whereas all the other classes of folks under Medicaid, it's different based on state, but it's somewhere between 50% and 77%. So our big idea is not get rid of Medicaid. Let's just phase down over the course of 5 to 10 years that percentage cap that able-bodied adults get to make it equal with the other populations that make up Medicaid.
I would think that our proposal is way more in line with when Medicaid was ever created. I don't think it was ever created in order to fund the health care of able-bodied adults. What effect do you think it would have other than saving money? I mean, why are people, would they be opposed to this if it's such a cost saver?
Yeah, I mean, David, it seems like common sense. Our partners at the Medicaid Institute found that this legal change actually shifted resources away from low-income children. So it's not only that we're spending more money, but that the money actually flowing to these more vulnerable populations is actually being reduced because we have this expanded higher federal contribution for able-bodied adults. And so that's why we at AFP and the Paragon Institute have been elevating this to Congress to say, hey, this is an idea to save some money this year. You're talking about saving some money. Let's step in and let's just make this equal. We're not even saying get rid of the program or cut the coverage. We're just saying make it equal for all of the populations under the program.
So if our goal is ultimately to cut $2 trillion, that's a pretty unbelievable number, but to cut $2 trillion, how much would these cuts go towards that goal?
Yeah, so these cuts would actually save $529.9 billion over the next 10 years by making this simple change to the program.
So that's a significant step. Well, I mean, seems very logical to us. I'm sure a lot of the people listening to this. What's the response from Congress?
There have been a number of members of Congress that have embraced this idea and want to move forward with this idea. But I think, as you know, healthcare is a pretty difficult topic for members of Congress to come to agreement on. And so we hope that as we're reevaluating spending, that this is a big part of the federal budget and that we can do these types of common sense reforms that don't risk taking away healthcare for anyone or actually harming anyone's health. They actually ensure us to spend the money more realistically in a more common sense way over the long term.
Are there any champions of this on Capitol Hill or any leaders out there who have picked this up?
I mean, we're really waiting for that big champion to step up. Like I said, AFP and Paragon have been talking to a lot of members about this, but we're waiting for that one that's willing to kind of lead the charge.
Yeah, I mean, it seems like a very logical way to save a lot of taxpayer dollars. And I mean, again, I think that the work that DOGE is embarking on is wonderful. I couldn't be happier. When President Trump announced it, I thought it's just not only the practical work they're going to do, but just the signal that it sends to try to get serious about spending. I mean, we haven't seen that in decades under Republicans or Democrats. So that message, and then what seems to be the initial follow-through is really encouraging. So hopefully that sends the message to, partners in Congress to take up that seriousness about getting the deficit and debt under control. I know that we're going to be spending a lot of time talking about DOGE and practical cuts and real-world examples of, savings. What's the sense amongst you and your team as you kind of embark on this?
Yeah, I mean, I think our sense is the opportunity is massive. And so we're trying to come up with as many ideas that we can elevate to members of Congress to give them the good ideas to do, the tangible ideas that can actually be implemented and that their constituents are calling for them to do. I mean, we see from our grassroots activists when we get to talk with them from the policy team, they're passionate about this. They want to see government spending be used more appropriately, and they want to see their taxes go down. And so the reality is for taxes to go down, we have to also cut spending at the same time.
Yeah. Well, if people want to give us their ideas of where cuts should take place, where can they go?
Yeah, David, I'm really excited that we have launched DogeIdea.com. So as I mentioned, we get a lot of ideas from our grassroots. That's the way that our policy team here at AFP gets a lot of our great ideas, is traveling around the country, talking to our state teams and talking to our local activists and volunteers. So we're excited to be able to do this en masse for this series and for this particular initiative. And so that's why we have launched dogeidea.com for folks to submit their ideas, and then you and I can have the opportunity to talk about them here, but we'll also be taking them to Capitol Hill and to the Trump administration to elevate those great ideas.
Great. So it's DOGE idea.com.
That's correct.
All right. Well, hopefully everyone will go there and go with their best, we'll crowdsource some of the best ideas that we have. Thanks, Jeremiah.
Thanks, David. Appreciate you having me on today.
Always. I know we're going to do it a lot more, so it's going to be fun. As we wrap this episode, be sure to go to the website Jeremiah mentioned, because with the government spending at $6.8 trillion last year alone, we could use your help to see what you think should be cut. The website, again, is dogeidea.com. Always remember, liberty and freedom are easily taken for granted. Don't take it for granted. Go out there and defend liberty and freedom. If you like this episode and would like to stay connected with the podcast, be sure to like and subscribe to our channel, as well as following us on Facebook, Instagram, and YouTube. Thanks for joining us, and we'll see you on the next episode.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.